guys, this is me from the future just popping in to explain what prolotherapy is and why I'm having it. So prolotherapy is an injection of a sugar solution, and basically the idea is to create an inflammatory response in the area that is being treated to promote healing of the soft tissue and ligaments and tendons in that area to help with pain and, in my case, instability of the joints in that area. So I'm having prolotherapy in my cervical spine, my neck, below my craniocervical fusion. So I'm fused skull to C2, and I'm having prolotherapy injections below C2 because I do have significant instability below my fusion and we want to avoid further surgeries. So I'll keep you updated on how prolotherapy goes and if I have success with it. Prolotherapy is done and it went just fine. It is about 30 needles being poked into your neck, and so it's not necessarily enjoyable, but it was fine and it went pretty quick. We liked the doctor that we went to, and he says that he's treated a few EDS patients, and he uses ultrasound guidance just to make sure they're not hitting anything that they shouldn't be. They do inject a little bit of like numbing stuff, but for me it really didn't help that much, but it was fine. If you are used to having a lot of like needle sticks, then you'll be fine. They want me to repeat the injections in 3 weeks, and they typically do 3 rounds. I know with EDS patients, prolotherapy doesn't always last as long as for people in the normal population, but we will see. I've talked to some people that have said they've seen results within just a few days after prolotherapy, and some people that it's taken a few weeks. They told me that it would probably be a few weeks at the clinic I went to, but we'll see what happens, and I will let you guys know if I have any improvements or if I don't. It has been since Thursday, so I think that's 4 days now. It's Monday. I had a rough day after the prolotherapy, and I don't know if that was because of the prolotherapy or if it was just like a really rough day, but I spent most of the day after prolotherapy resting in bed. And the next day I did a little bit better, but was still feeling pretty awful. And yesterday and today I've been doing a bit better. I have been out doing my physical therapy, and I ran an errand at a store, and so now it's really hurting and it's not feeling better anymore. It's hard to gauge how I'm doing, but and what's affecting what, but I just thought that I would give an update and share that I'm not doing horribly worse or anything like that after having prolotherapy. And to be honest, I really didn't feel like I felt a lot of like side effects from it. Actually, the day of prolotherapy, that night my throat felt like it was really itchy and swollen, and I didn't know if it was like a reaction to it, but it was just something that you could just like take Benadryl for and be okay. I'm hanging in there, and I'm struggling when I'm not wearing my neck brace, but I'm trying to not wear it as much as I can handle. I still get that, like, when I put my brace on, it's like, oh, you know, that moment of relief. At this point, at 3 months post-op, I should be able to be out of my brace most of the time if I were to not have instability below my fusion, but because of that, I'm still really struggling to come out of the brace. But I'm still hopeful for the things that we're doing, and I will just keep pressing on. So yeah, I'm gonna go get my chicken nuggets. It has been 2 weeks now since my second prolotherapy treatment, and so far I haven't had any like complications from prolotherapy or anything like that. I think that it might be helping a little bit, but I am kind of experiencing what they call like the roller coaster effect or the honeymoon effect, where in the beginning you'll see some improvements and then you'll have some days where it's really bad again, and it just kind of is like an up and down road. And so I definitely still always feel better when I have my neck brace on, no matter what time of day it is. But thankfully, most of my mornings have been a bit better. I've had less neck pain for like the first few hours of the day, kind of like a level that's like tolerable for me. And so I try to keep my neck brace off for as long as I possibly can throughout the day and only use it when I need it, when I feel like my symptoms have gotten just too bad to handle. And so I have been keeping it off more lately, but when the afternoon and evening hits, my symptoms tend to get worse. I just am kind of taking it one day at a time and, you know, doing what I can do with what I've got. And I'm still hopeful about prolotherapy. I don't expect it to be like a cure or to solve everything. I think we've kind of learned that there's no perfect fix for what's going on, and in the end it's going to be a combination of like a lot of different efforts in order to help me to feel better. Whatever it might be, like I'm just hoping to keep finding things to help a little bit, and those will add up and really improve my overall health, if that makes sense. I definitely don't have anything negative to say about prolotherapy so far. It seems like it's helped some, but it's also difficult to tell if that improvement is from continued healing from my surgery or from the prolotherapy itself. But I do have that instability below my fusion, and so we know that something needs to be done about that, and I'm hoping that that's just going to be prolotherapy and physical therapy, so we won't have to do more surgery. But we'll see what happens. What was I gonna say? Oh yeah, another update is that I have been able to drive short distances lately. I don't like driving because I have to drive with my neck brace, and also I really don't have any range of motion in my neck, and so like looking, you have to kind of turn like your entire body when you're driving, and I just don't really like it, and I typically like don't feel well, so I'm not like going out all the time. But you know, for things like physical therapy down the road, or doing like a Walmart grocery pickup, or driving through to get some lunch, I can usually do that just fine. And thankfully for my seizures and dystonias, I always have warning symptoms, and so I always know when those are gonna happen, so I feel safe driving. And typically my seizures and dystonias only happen when I'm laying down or reclined, and so it's very rare for that to happen when I'm sitting up. So anyways, just in case you're wondering about that. And yeah, I think that's about it. I just had 2 prolotherapy sessions before my tethered cord release surgery, which is going to be in less than 2 weeks now. We'll continue the prolotherapy after surgery and hope that it'll make a difference in the long run, and that I'll continue to see improvements. I definitely have come a long way since, you know, the first few months of my surgery, and sometimes it's hard to remember that when you still feel really sick, if that makes sense. And so like day to day I'm just like, oh, you know, things are really hard, but when I look back, it's like, wow, like things were really hard, you know, when I had that infection and all that stuff. So I'm thankful for where I'm at and the progress that I've made, but I really do hope to make a lot more progress. So I hope that anyone else who's trying prolotherapy sees some good results too, and if any of you guys have tried it, let me know how it's gone. And I'll continue to like update how my prolotherapy goes as time goes on. I'll go ahead and end this one now, but I will look forward to seeing you next time. Bye guys.